Good morning, everyone. Just to give you an update, we have two board members en route, but we're going to get started. We've been in communication with them. I would just want to welcome everyone to today's meeting for the Michigan State Board of Education. It's an honor for me to be here to chair my first meeting as State Superintendent of Public Instruction. And I want to thank the board for its confidence and welcome those joining in person and via YouTube online. So the time is now 10:05, and a quorum of the board is present. The State Board of meeting scheduled for December 13th is called to order. The first order of business that we have is approval of the agenda. Is there any board members that would like to add or delete anything from today's agenda?
I move that we accept the agenda as is.
Moved. Dr. Pugh, second. Second. Dr. Pritchett, thank you. Is there any discussion?
Yeah, I'll be voting no. I think we should be having on the agenda at least discussion about the compensatory services litigation regarding during COVID and special education students and how that litigation is going on at the U.S. Department of Education's Office of Civil Rights. And so, yeah, I think that should be on here. Thank you.
Mr. Bullock? Senator Bullock?
Not disagreeing, but if a board member wants to have something on the agenda, they should put in to have something on the agenda instead of waiting until the meeting to say they're not going to vote for the agenda.
Miller?
Yeah, I mean, I've said this numerous times. It's not a surprise. I've said it at least 6 of the last 12 meetings, so it's ridiculous, but thank you.
We'd like to give our new superintendent a chance to acclimate himself to our concerns.
All right, I'm going to vote no.
Okay. Thank you. Any other discussion? Okay, hearing none, Ms. Evans will take the vote, please.
Bullock?
Yes.
Lipton absent. McMillan?
No.
Pritchett?
Yes.
Pugh?
Yes.
Robinson?
Yes.
Snyder absent. And Tilly?
Yes.
Motion passes.
So the first item on the,
Yeah.
oops,
Oh,
I'm
yeah,
sorry.
that's okay.
I'm excited to
We're
get
all
to
good,
it.
yeah,
All
we're
right.
excited. I'm excited too. We're all
Slow
already,
down.
especially we all
Okay.
made it here. Thank you, Dr. Pugh. At this time, Ms. Liz Evans, State Board Executive, will introduce the members of the State Board of Education. Ms. Evans?
Good morning. You've just been listening to Dr. Glenn Maleko, Chairperson of the State Board and State Superintendent. To his left around the table is Board President Dr. Pamela Pugh from Saginaw, NASB Delegate Dr. Mitchell Robinson from Okemos, Mr. Corey Rosser, the 2025-26 Michigan Teacher of the Year, and Ms. Emma Young, the Deputy Director of Public Policy in the Governor's Office, ex officio. Now seated to my right is Mr. Tom McMillan from Oakland Township, Board Treasurer Mr. Marshall Bullock from Detroit, Board Co-Vice President Ms. Tiffany Tilley from West Bloomfield, and Board Secretary Dr. Judith Pritchett from Washington Township.
Thank you, Ms. Evans. Again, welcome everyone. I want to talk about public participation. The public may register to provide comment during the public participation portion of the meeting at approximately 1 p.m. Those wishing to make public comment must register before 1 p.m. To provide public comment by telephone, please complete the registration form on the MDE webpage. To provide public comment in person, please scan the QR code located on the stand outside the boardroom and complete the registration form. These instructions are also listed on the MDE webpage. Thank you.
Okay, now we're ready for the first official agenda item for today, which is a ceremonial swearing in of Dr. Glenn Maleko. And I am so honored today to welcome Dr. Maleko as our new Superintendent of Public Instruction here for the state of Michigan. So we'll stand here.
Thank you, Dr. Pugh.
And if you can raise your right hand. I, Glenn Maleko, do solemnly swear
do solemnly swear
that I will support the Constitution of the United States
that I will support the Constitution of the United States
and the Constitution of this state,
and the Constitution of this state,
and that I will faithfully discharge the duties
and that I will faithfully discharge the duties
of the Office of Superintendent of Public Instruction
of the Office of Superintendent of Public Instruction
according to the best of my ability.
according to the best of my ability.
Welcome and
Thank you.
congratulations.
Thank you so much, Dr. Pugh.
You're ready to go.
Thank you very much, Dr. Pugh. Thank you all board meeting members. I'm really excited. The day finally came yesterday where I was here to start, and I want to thank the warm welcome of MDE. Had some really nice signs, and they've already helped me get acclimated, and we have a great staff here. I'm excited to work with all board members, to work with the talented MDE staff from the department. You're going to hear later in the agenda that I'm going to talk about collaboration and how that's important during my report. But I can just tell you, we're going to maintain that mission of students first and doing what's right for Michigan students. So I want to collaborate, I want to work together, and I'm very excited to work with all of you. And again, thank you to the board for this opportunity and for your support and confidence and as we move forward with this. So I appreciate it. You're going to get more details, but we'll have to wait till closer to the end of the meeting when I have my official report. And I do have a slide deck presentation to talk about priorities there. So thank you so much. All right, and the next agenda we have is a presentation on Michigan's top 10 strategic education plan, Goal 3, improve the health, safety, and wellness of all learners. This includes metrics on asthma and lead. The Michigan Department of Education has partnered with the Department of Health and Human Services to provide an update on asthma and lead, as well as the current state of immunizations. Dr. Diane Golzinski, Deputy Superintendent of Business Services, Health, and Library Services, will be our presenter, along with Ms. Amy Aluniz, Director of Office of Health and Safety, Dr. Natasha Badusarian, MD HHS Chief Medical Executive, and Dr. Sarah Lyon-Callow, MD HHS Business Director and State Epidemiologist. This is an informational presentation, and no action is required by the board. Time limit of 50 minutes. Welcome. We're glad to have you here. Thank you.
Thank you, Dr. Maleko. Welcome to you as well. And good morning, board. It's great to be with you on this snowy morning. Glad that you all made it here safe. I am here with the experts who know what they need to be talking about, so I'm going to be quiet today.
So when we discussed the goal 3 of the top 10 strategic education plan, which is to improve the health, safety, and wellness of all learners, we wanted to discuss a couple of metrics that are involved in that goal. We do have 2 metrics that are around asthma and lead. So what we're going to do is we are going to begin by taking a look at asthma.
Whichever one makes you happy.
So in the strategic education plan metrics, we have 2 to note. One is the percent of children ages 0 to 17 who have ever been told that they have asthma by a physician. We also have a metric for the percent of children ages 0 to 17 years who are currently have asthma. So I will turn it over to Dr. Lyon-Callow to discuss.
Good morning, and thank you everyone for having us here today. I want to share some of our most recent data, just to orient you to this graph a little bit. You can see the top blue line there is the prevalence of children who have ever been told by a doctor that they have asthma, or lifetime asthma is how we refer to that. In 2024, there were 12.6 children had been ever told they had asthma by a doctor. This value has ranged on that graphic between a low of 9.9 to a high of 12.6, but those differences really are not statistically significant, so it's a pretty flat trend. Looking at the gray line, we can see the percentage of children who still have asthma. This has ranged from 7.8 to 9% over the last 6 years, which is really not a statistically significant trend either. All right. We will have a data source change for this metric. 2024 is the last year that the Centers for Disease Control and Prevention will support surveillance of childhood asthma prevalence on the Behavioral Risk Factor Survey. We will be shifting to the use of the National Survey of Children's Health, which is a very robust survey for getting a statewide estimate for both of these metrics. However, you will not be able to understand demographic or geographic detail out of this survey. Next slide. We were also asked to talk a little bit about the kinds of initiatives that are underway to support students with asthma. I'm going to just briefly share about these, but always happy to share more information. The MDHHS asthma program has partnered with the state school nurse consultant and the Michigan Association of Intermediate School Administrators to develop an EduPath course called Supporting Students with Asthma. That free course provides you 0.25 of a state continuing ed clock hour. And it provides educators with an understanding about how asthma affects student performance and what to do in the case of an asthma emergency. It also enables educators to connect with the American Lung Association's Asthma Basics program, which provides an hour of course credit and teaches participants to recognize and manage asthma triggers, to understand the value of an action plan for a student with asthma, and to more information about how to recognize and respond to a breathing emergency. As of October 1st, we had more than 115 educators that had taken the EduPath Supporting Students with Asthma course. We've also worked on a standards of care toolkit with the MDHHS state and MDE, state school nurse consultant. This toolkit guides the school nurse, certified asthma educators, or any other professionals in the building to provide school personnel with complete training around asthma. Another program we're supporting is the American Lung Association's Open Airways for School nurse training. The concept here is that ALA trains school nurses on the Open Airways for Schools program, and then they go on to implement this program in their district in sort of a train-the-trainer model. As of October 1st, 2025, we've had 55 school nurses that have been trained and are operating as facilitators right now. Very proud of our electric school bus program. This really, there was a coalition that's been formed up called It's Electric Coalition. And they educate school staff, nurses, administrators, transportation directors about the dangers of diesel exhaust. They illuminate the benefits of electric school buses, share funding opportunities, help schools write grant applications to get a replacement of a bus. And through these efforts, Michigan has gone from having 17 electric school buses on the road in 2019 to having 321 buses either in use or awaiting delivery in 2025. Funds for these school buses have come from the EPA's Clean School Bus Program and Michigan's Clean Bus Energy Grant. And a relatively new project we have is, it's called the School Nurse Nexus Project. This links school nurses to resources offered by Medicaid health plans in Michigan. So it enables the school nurse to provide some care coordination to enhance communication between the schools and the health plans and increase children's access to care. And it's modeled after a very successful program that the state of Missouri runs. Okay, so we'll move on to lead. We have two metrics that we want to talk about here, so go ahead and jump to the next slide. We want to understand the percentage of children who have been screened or tested for lead. So the graphic on the left-hand side of the slide is presenting to you the trend line for the percentage of children who have had a blood lead test, and these are children 0 to 17 years of age. You can see our testing rates dropped during the pandemic, and they have recovered sharply since that drop. And they are now at the same level and trending upward from where they were pre-pandemic. Looking at the right-hand graphic, this is giving you the percentage of children who had been tested for lead that had an elevated blood lead level. That means that they had 3.5, oh, try that one, okay. Oh, that's much better, thank you. My apologies. So an elevated blood lead level is where you have 3.5 micrograms of lead in your per deciliter of blood. We had, currently there are 5.6% of children who have been tested for lead that had an elevated blood lead level. So we're expecting that the number of children that are tested are going to increase. In 2023, there was a state law passed that enabled universal blood lead testing. So now by law, children at age 12 months and 24 months will be tested for blood lead. There's additional testing that can occur based on the risk of exposure to lead. This approach is commonly called universal blood lead testing. It is the physician's responsibility to test or order the test. Testing requirements do not apply if a parent or guardian objects to the test. Rules were promulgated through the JCAR process for this and became effective on April 30th of 2025. I also mentioned that there are other reasons why you may be tested besides just 12 and 24 months. You may be tested based on the geography you live in, based on the percentage of children with elevated blood lead levels, the age of housing in communities, and the percent of poverty, households in poverty in communities. We've identified 82 cities or townships designated higher risk. So children living in those townships or cities would be expected to get a lead test at age 4. And then physicians and parents are expected to assess risk in their child. So if a child lives in a home that is older than 1978, if they live in a home where other children have had an elevated blood lead level, if they, perhaps there is somebody in the home who has a job or hobby that involves a lot of exposure to lead, a variety of other things. If a physician or parent identifies that, there would be another test provided to that child. All right, the next slide, I mentioned those 82 communities that are considered high risk under the universal testing rules. You can see the geographic distribution on the slide of those communities. And then I wanted to share with you how our blood lead testing metrics look in those high risk areas. So the data in the figures above, it's the same kind of metrics that you saw for statewide before, but now we're just looking at those 82 communities. Testing rates, similar to the state as a whole, have recovered since a drop during the pandemic and are now slightly higher than the state rate. And then the percentage of children with elevated blood lead levels in these communities, we saw that same pattern of a gradual decline from 2021 to sort of a flat trend. And 7.8% of children in these communities are considered to have an elevated blood lead level. Okay, my last piece of information for you is what are we doing to increase lead testing and to reduce lead exposure? So I've talked quite a bit about the universal lead testing law and rule set. I'm going to talk a little bit about the Filter First program. In order to protect Michigan children from exposure to lead in drinking water, the Clean Drinking Water Access Act and amendments to the Child Care Organizations Act, collectively known as Filter First, were signed into law in 2023. These laws require schools and child care centers in Michigan to develop a drinking water management plan, to install lead-reducing filters on all consumptive fixtures, and to test filtered water. That program continues. The Michigan Department of Health and Human Services continues to recommend that households where you have lead or galvanized plumbing, you have a lead service line, or you have old faucets or fixtures sold before 2014, we'd recommend that those households consider using a certified lead-reducing filter on their consumptive faucets. And we do have a couple of safety net programs, the faucet filter program to aid families who are Medicaid eligible in obtaining those filters, as well as our foster care families. If a child does have a elevated blood lead level, they are also eligible for nurse case management. Every local health department in the state provides nurse case management, as does CHAP in Genesee County. And those nurse case managers will often connect in with schools or daycares regarding potential lead exposures that may be occurring. We've also been looking at our Medicaid data, trying to identify, are there barriers that we can see in claims data to children getting lead testing? So we looked at 57,000 children that had had a well child visit before the age of before the age of 2, and we found about 54% of those children had a blood lead test. So thinking about a provider's well child visit as an opportunity to get that blood test, we're providing information to healthcare providers about how to get lead care testing in their facilities. So very often providers will cite as a barrier to testing, a parent having to get a referral to a testing lab. We want to try and remove that barrier for parents by providing point of care testing machines to healthcare providers. 2025, we had more than 120 healthcare providers apply for one of these machines, and we're able to provide that. So we're increasing access to screening across the state. And in the interest of time, I will stop there and turn it over to Dr. Bagdasarian.
Should I use this one? Yeah. Hi, everyone. Thank you so much for inviting us to come and speak to you all on this snowy day. And I just want to thank you all for caring about the health of kids and everything you do in this role. I'm going to talk a little bit about vaccines and what's happening with vaccines in 2025 as it pertains to our kids. And we can go to the first slide. This is a look at the Michigan school vaccination requirements, and these have not changed in recent years. These have been set for quite some time, and these are really diseases where they're preventing a lot of morbidity and mortality for kids for diseases that can be really quite awful. So we've got things like diphtheria, tetanus, pertussis, polio, measles, mumps, rubella. If you will notice, what's not on the school vaccination requirements are things like COVID or influenza vaccine. And again, these have been present pre-pandemic. First slide, please, or next slide. Here's a look at where we are as a state in terms of vaccine waivers. I think it's important to sort of realize that Michigan actually has a pretty liberal allowance when it comes to school vaccination waivers. And in Michigan, people can opt out of vaccines not only for religious reasons or medical reasons, but philosophical or personal reasons that they may have. So we're one of the few states that allow for vaccine waivers for any of those things. And one of the trends that I want to show to you all is the trend when we look at vaccine uptake. So this is actually a look at kids before their school age. So this is a look at kids below the age of 35 months and what's happened with vaccine uptake pre-pandemic until now. And one of the trends you'll notice here, I'm just going to use my laser pointer on this one. Oh no, I'm out of battery. It's okay. What I'm going to show you here is essentially a trend where you can see that pre-pandemic, we'd been doing pretty good with vaccine uptake. We were at around 75%. And then there was a sharp drop-off as the pandemic started, which was really expected. There were a lot of kids who weren't getting their care in person, a lot of telehealth. A lot of folks weren't really focused on preventative care at that time. And I was hopeful that these rates will recover. And we did see a little bit of recovery in about 2023, 2024, but those rates have fallen again, and we're at about 68%. So this means fewer of those little ones before they go to school are protected against diseases that I mentioned, things like measles and pertussis. Now, when we look at school-age kids, we're seeing those same sorts of trends. So this is a look at kindergarten and 7th grade vaccine coverage. Again, we saw those numbers drop off after the pandemic started, and they have not recovered. So when we look at these numbers as a whole, it doesn't look too bad. We're at around 90% statewide. Next slide. Thank you. But when we start getting into geographic variation, that's when we start seeing some at-risk communities. So the green counties here are counties with a coverage rate of less than 70. Oh, thank you so much. I'm very emotionally tied to this laser pointer, which I brought with me today. Thank you for the batteries. So one of the things, and it doesn't work on a screen. Oh, okay, that's okay. We're still okay. One of the things you'll notice, so the green counties are counties that have vaccination rates lower than 70%. So if we look at the map of 2011, you'll see that it was sort of, we had some geographic clusters of counties with those low vaccination rates. So some in the upper lower peninsula and some in southeast Michigan. By 2017, there were very few counties that had those super low rates. And then by 2024, you can see it's almost the whole state with those very low rates of vaccine coverage. The majority of counties are in that lower vaccine coverage spectrum. Next slide, please. And there's even more variation when we drill down even deeper and when we look at the individual school building. So this is actual data from a website that is publicly available that shows you vaccine coverage by school building. We have not listed the names of the school here, but what you can see is there are schools out there in Michigan with vaccine coverage of 28% and 30% and 40%. And what that means is that those schools are really vulnerable to certain diseases. And we can go to the next slide. And I want to just show you what's happening with measles. And I bring up measles in particular because it's sort of the canary in the coal mine when it comes to vaccines and vaccine coverage. We're seeing a huge resurgence of measles in the US this year. In fact, Canada just lost their measles elimination status, and the United States is probably next. We've had almost 2,000 cases of measles in the country so far this year. And you can see those numbers were steadily climbing before the pandemic. Measles sort of died down during the COVID pandemic because people were staying at home. And then in 2025, again, those numbers have been going up. The vast majority of cases of measles have been in folks who are unvaccinated. And we've had 3 deaths in the US this year. Now, these numbers, 3 deaths might not sound like a lot. This is the worst year we've had for measles cases and deaths since 1992. So this is shocking. And I'm expecting things to keep getting worse given what we're seeing with those vaccination numbers. Next slide, please. This is a similar sort of look at vaccine coverage by county when we look specifically at the MMR vaccine, the measles, mumps, rubella vaccine. And again, you can see that that 2024 map is much worse than the 2018 map. Lots of low vaccine coverage counties here. Next slide. And we have had measles outbreaks in Michigan. So we have had 3 outbreaks, and multiple counties have had measles cases. Many of these cases have been tied to the outbreak that had been happening in West Texas that's now spread over to New Mexico. There was another huge outbreak in Ontario, and some of our cases have been linked to that outbreak. And measles travels very easily. Measles is so transmissible that you can actually get measles from someone who was in a room and left 2 hours ago. It can hang around in the air for up to 2 hours. So it's incredibly transmissible. And about 20% of kids who end up with measles require hospitalization, which, you know, if any of you have seen a child in the hospital, it's a very emotional, very upsetting thing for everyone involved. So 20% require hospitalization. And the thing with measles is it actually not only is the measles itself that causes devastating illness in the patient, but it sort of, for a time period, it suppresses your immune system. So you're vulnerable to all kinds of other infections for up to a year after that case of measles. And many of the measles deaths that we see are from things like secondary bacterial pneumonias after the case. So we have had multiple cases of measles in our state. You'll see those 3 outbreak-associated cases. Those are the pink counties. And we haven't had more than 7 cases in an outbreak. And I have to tell you that this is not luck. This is our local health departments who are working tirelessly. It takes an incredible amount of staffing and hours of contact tracing every time there's a measles case to make sure it doesn't spread. So this is a look at 2025. Again, I would anticipate 2026 continuing on this trajectory that we're on, unfortunately. And my last slide just shows you, this is actually a modeling tool from the University of Texas that they put out when they first started having their big measles outbreak. And this is a modeling tool that tells you what would happen in a school if there was a single measles case, depending on the vaccine rates. And I've used real Michigan data from that previous slide I showed you. So this is a school with 200 students with a vaccination rate of 28, which is one of our schools with that low vaccination rates. And you'll see that if there was a single measles case in a school like this, it would result in 143 new cases. So that school would essentially have to shut down. And this is one of the reasons why I am so concerned about the vaccination rates here in Michigan. The measles vaccine, for one, but many of the vaccines I've talked about today are vaccines that we got as kids. Many of our parents got them as kids. And these are vaccines that have eliminated diseases in our country like polio. We no longer have kids who are living in iron lungs because of the polio vaccine. We no longer have kids dying in the kind of numbers we did due to the measles vaccine. So just wanted to share some of this information for your awareness. Again, thank you for everything you do, and happy to answer any questions you might have.
Thank you so much to our partners and our guests from DHHS. Dr. Maleko, back to you.
Thank you very much for the quality presentation. Really appreciate it. Is there any questions from any board members or comments? Ms. Schneider, good morning.
I'm happy to have made it here safe. The roads are not awesome. Just a few questions around the concern that you have about childhood vaccination rates to kind of backtrack and understand them a little bit better. Is there a lifelong study for participants that have received annual vaccinations every year of their life?
Can you tell me a little bit more what you mean about that? So
Reflects a participant that has received annual vaccination every single year of their life.
well, the vaccines that I talked about today, those aren't vaccines that you would get every year. So MMR, for example, there are 2 doses of MMR.
I'm not talking about those. I'm talking about any research, evidence, or science that reflects a participant or participants that have received annual vaccination every year of their life.
I'm so sorry. I'm not understanding because you wouldn't get any of these vaccines every year of your life. That wouldn't make sense.
Any vaccine. Is there a research study of participants that have received any vaccine that exists every year of their life?
I don't know that such a study would necessarily be feasible or would make sense.
Well, there is not, there's not a research study because no one has ever signed up to be a part of a research study where they've had a vaccine every year of their life. Do you recommend the annual flu shot?
I absolutely do, yeah.
Okay. So, in acknowledging that there is no science to back up the safety of annual vaccination recommendations and the trend that you're sharing with us today regarding childhood vaccinations, do you think people should feel safe with your recommendation to get annual vaccinations when there is no science or evidence to back it up?
Ms. Snyder, if I could just say, none of my talk today focused on flu vaccines. In fact, it had nothing to do with flu vaccines.
Tie them together. I'm asking you, do you think people should feel safe?
Yes, I absolutely think they should feel safe.
Yep. Even though you've acknowledged there is no science studying annual vaccinations across a lifespan.
There are studies on folks who get flu vaccines on an annual basis.
For their entire lifespan, there is none.
Well, that wouldn't be feasible for their entire lifespan.
Acknowledging that it would not be feasible to do the research it takes to ensure safety. Okay, so here's what I'll say.
I just want to make a comment. I think we can research that and get back to you.
No, the
on,
research is there. I know it's there because,
well,
Diane, I am an
fairness to
expert. I've gotten an education in how to do evidence-based research and practice. So I feel confident in having this discussion respectfully without being interrupted, Dr. Maleko.
Well, Ms. Snyder, in fairness to the presenter.
The last thing I will say is this. One of the issues we have with childhood vaccination rates that you are talking about here today is that if you encourage that schedule, you want to make sure that your recommendations actually go hand in hand with science-based, evidence-based research, and it does not exist. So what ends up happening is people come to you and they don't feel safe. When we recommend something we don't have the evidence to back up is safe, now they pull back and they retract. So we saw that post-COVID. I saw it as a nurse working in the hospital every day. I see it as a school nurse working in schools every day. We have to start rebuilding trust in our healthcare institutions and our school institutions. And it doesn't start with recommending something we don't know for sure to be safe. It then finishes with the concept of informed consent. And right now, when people go to MDHHS, they have to sign a waiver when the law says it's an exemption in relationship to education that says, I attest, I am waiving these vaccinations without understanding fully the risk that it might bring to them. You have to encourage both sides of the education conversation, and you really do have to go at it from the perspective of, I'm going to make sure that my recommendations are in fact safe. We do not have research that actually backs lifelong participation in annual vaccination. And it should be feasible. It should be feasible.
So Ms. Schneider, can I just interrupt for a second here, please? We appreciate your comments. In fairness to the presenters, they were here for a specific purpose. She's already answered that we weren't here to talk about the flu vaccine. If there's research that you need, we're happy to research, look into it, and get back to you.
It doesn't exist.
But in fairness, I think you're making some statements. There's also commentary on how vaccines are safe and healthy. I get my flu vaccine every year. I'm a proponent of vaccines. I think it's worked for my children. I also support individual rights to for their children and their family, and they can make their individual choices with them and their doctors and physicians. But there is also a lot of research on helpful vaccines, and so I think she's answered that. Appreciate your statement, and I'll move on to Mr. Bullock, who now has the floor.
I was actually going to make a
Senator
similar
Bullock.
statement just to
Okay.
help move this along, because thank you for your presentation and vaccine, on what you presented on the asthma and the lead. But I was going to counter with the myths of vaccinations and the things. What are the things that, or what would you say about the things about vaccinations and how they reduce people going to the hospital, reduce medical care, reduce all of these other things, like how the vaccinations work in our society to make things easier on the rest of us that we do have trust in?
Yeah, that's a really great question. The MMR vaccine, the measles, mumps, rubella vaccine, it protects against 3 diseases. And for the measles portion of it, I already mentioned that 20% of kids who get measles end up in the hospital. The MMR vaccine, if you get 1 dose, it's 93% effective at just shutting down the disease completely, halting transmission, preventing even mild forms. And 2 doses are 97% efficacious. So not only are you protecting against measles in a really, really effective way, but you're also protecting against rubella, which there is something called congenital rubella syndrome, where a mom can pass rubella on during pregnancy and end up with birth defects, and mumps, which can cause infertility in males for their life. And so these vaccines are not only keeping people out of the hospital, keeping them protected in the short term, but we're actually protecting people even into adulthood during pregnancies and protecting their fertility later on. So really, really a lot of benefits from these vaccines.
And for future, or just even now, like the credibility of the CDC and the research that they've done on vaccinations in these areas, plus others, do I want to ask about like how we get credible information from randomized controlled studies on how our vaccinations are. Well, there's historical and institutional content and all these other things that can validate what you're saying. I'm just trying to help balance this conversation back out.
Thank you so much. So in the approval process, vaccines go through randomized controlled trials before they are ever approved to be used in humans. When we look back at the polio vaccine, the first trials actually took place right here in Michigan at the University of Michigan School of Public Health. And I had the privilege of speaking to, they're now in their 80s. They were kids who were in that first polio vaccine trial. And when they talk about the approval of the polio vaccine, they said church bells rang around the country, and moms sat by their radio and wept tears of joy because there had been so much fear of their kids getting polio every summer. So thinking back at the historical context, these were vaccines that gave us a lot of hope as society. And we've simply forgotten how bad these diseases were.
So thank you, because I've done a lot of studies and research on this very thing, and I'm a guy who got chickenpox at 29. So like we can talk about, so I have some credible information too. Like some people, we sometimes we forget to check other people's backgrounds at the table. That's okay.
Thank you, Senator Bullock. Dr. Robinson?
First, thank you for this presentation, really informative. I want to back up kind of one layer up and talk about school nurses for a second. Where I grew up, there was a school nurse in pretty much every building in upstate New York. We currently have one school nurse per 750 students in our state. We talk a lot about state rankings based on standardized test results. Here's a state ranking based on actual numbers of nurses per children. We're at 1 per 750, which is 6 times higher than the recommended number of nurses per student. I just want to add my voice to the chorus of people that have been requesting more school nurses in schools. I know that school administrators in the state have made this request. I think we've talked about it on the board several times. I know in the legislature people have talked about it, but I think what you're pointing to here is some really good evidence that the first line of defense here is more health professionals in schools. Go where the children are. And so I just want to make a public comment here that we need more nurses in schools. And right now we are not serving our children as well as we could because we don't have those people in schools. So thanks again for your work.
Thank you. Dr. Pugh?
A couple of questions, and thank you all for all that you do. Some of us did it. We're working together before our hair turned gray. I always have to bring that up. So good to see that you're still at it. A couple of questions related to lead. I guess I'll start with vaccine rates. We passed a resolution here at the board table that goes along with some of the legislation that has just been proposed out of the House related to vaccine levels. And you gave us some data at the school level. There are concerns that there may be some changes to being able to get vaccine rates at the school level. Do you all have any information on that?
Yeah, we're not concerned at this point in time about our process or the ability to continue our process for getting that information at the school level.
Okay, great. Because the thought was that they're moving to, I think it's away from the MICR system to a new system. Is there?
Oh, okay. So the Michigan Care Improvement Registry, which is our immunization registry system, it has been running since when we were working together, Dr. Pugh. Anyway,
Yes.
At least 2001. Anyway, and we are modernizing that system. So we're really excited. We're finally able to replace the system. I want to be clear that the bid and the requirements for the replacement system did include being able to look at coverage
Awesome.
and waiver rates for schools. That's an essential part of what we do here, and that is covered. I know there's been a couple of questions about it, but just want to assure you we will continue as the MICR is modernized. We'll be continuing that school data provision.
And thank you so much for that reassurance and for being here to clear that up. I have to say that something that sticks in my mind when I was going to my first orientation in college, there was someone who was at the microphone at the college and said, "Be careful of the sidewalk counselors. Always come to the people who are responsible and who know the information." We have a lot of sidewalk counselors, even at this table, that we have to be careful of because we see it showing up in those trends. And unfortunately, those trends don't just stop at who's getting vaccinated, but you showed how it ends up in health outcomes as well. And some of them are resulting in death of young people, very preventable diseases and deaths. So appreciate that. And then always appreciate the fact that we are getting the data and at the levels that we need it. Just a few thoughts. I'm sure that as well as influenza, you're not here to talk about Hep A. I don't know if you want to, or Hep B, I'm sorry, if there's any thoughts that you have on how that may show up in our schools as a result of the shift of the The shift that, again, was brought on by an attorney and not a medical professional, but is rolling back recommendations for babies, newborns, to get the Hep B shot. Any thoughts there and how we might want to be prepared for that in our schools?
One of the things, great question, by the way. One of the things that I will say is that we are continuing to follow the guidance given by the American Academy of Pediatrics, which recommends that birth dose of hepatitis B, because we know that that birth dose saves lives. And so our recommendation is to continue on. However, I think that the more confusion and the more chaos and controversy is created around vaccines, the more we'll see this trickle over into other things. And so it becomes not just about that hepatitis B birth dose, but maybe the hepatitis B vaccine at all, and then an overflow onto other childhood immunizations. And so I do worry that that controversy that was created without scientific backup is going to overflow and cause those rates to go down across the board.
And the data of harm, I just have a few more. The data of harm that's being spewed, is there, I mean, from the vaccines that you mentioned here to Hep B, I mean, is there data of harm? I understand that it's very limited, and that it's contrived or made up by, I can say it, for political reason.
So every time, again, I think it's a great point. Every time a vaccine is approved, one of the things that has to be done is risk versus benefit. So as a vaccine is going through its approval, you must make sure that the benefits far outweigh the risk of receiving a vaccine. And so all of the vaccines on our recommended schedule have been through that process, and the benefits far outweigh the risks. And so I'm so sorry, I totally got.
You're
Are there data on harm? So they've all been through that process, and with each one of the vaccines, there are adverse effects that can happen, but that equation has already been calculated that any benefit would far outweigh the risks. So, for example, one of the things that's brought up, it's not on our routine childhood vaccine schedule, but with COVID vaccine, one of the things that's brought up often is the risk of myocarditis in young men, the risk of inflammation around the heart in young men. And there is a very small risk of that with COVID vaccine, but we know that the risk of that happening with COVID infection is far, far greater. And only if the benefit outweighs the risk is a vaccine approved. And so that data has been looked at, that has been studied, and we know the risks of not giving a vaccine. I have a slide that I show in different groups that looked at what people in Michigan were dying of 100 years ago. And in Michigan, people were dying of polio and diphtheria and scarlet fever and typhoid. And those numbers just like plummeted because of three things: antibiotics, water and sewage, and vaccines. And we in this room got many of these vaccines as kids. So it is a shame to deprive our children of that same protection.
and individuals can talk to their doctors, their physician, but we're talking about for the greater population.
Absolutely.
And if I don't know if there's any other questions. I did have a few on lead, but thank you for that.
Any other questions from board members? Mr. McMillan, and then Ms. Lipton.
Yeah, I guess I'm just curious, Dr. Bagdasarian, are vaccine injuries real? I mean, do some people get injured, some kids, based on vaccines, because of the vaccine?
Absolutely. I think with any medication, drug, vaccine, there's always a risk of an adverse effect.
If data shows that a particular vaccine has more negatives than positive aspects, and it's currently on the childhood schedule, do you think it should be removed?
It would be. It would be based. It absolutely should be and would be based on our protocols.
And during COVID, I know that it was MHSSA or whatever it is that wanted kids to wear masks while they were playing sports. Did you support that policy as well?
Um, you know, I think that a lot of those were decisions that were made based on individual sports, individual circumstances, and what we knew at the time. So when COVID was first coming to light, there was a lot of fear, there was a lot of risk. The risk was much greater. And so at the time, decisions were made based on the available information.
But then the science changed. I mean, what we knew at the time, and then, then we became aware that maybe that wasn't the best policy, or certain policies were.
We're not here about mask wearing, we're here about immunizations and the schedule for schools.
So we'll direct back to the questions of your presentation.
I'm just trying to show that sometimes the experts are wrong. And so I think that's important for the whole discussion. Thank you.
Ms. Lipton?
Thank you. Through the chair, thank you for your presentation. And I just wanted to just make sure I understand two of the slides that you showed. The slide I'm referring to is titled School Vaccination Waivers. It's like a map of the United States. And then underneath it is childhood vaccines. So under the slide entitled School Vaccination Waivers, based on what you're showing, it looks to me like Michigan, when we're comparing it to other states, appears to be pretty permissive.
Yes.
I mean, you've got some states where it says no non-medical exemption. And some give personal. I mean, we're among the states that basically allow for whatever exemptions are available to other states. We give them all.
Yes, absolutely.
Okay. And that's been the law. I mean, that's you as a department, all of us who are in elected office, swearing to uphold the law, we're upholding the law. That's what the law says. Okay. In the next slide where it talks about childhood vaccines, it looks like in around July 19th through July 20th, we see a pretty substantial drop-off, and it just never recovers. Now, given the fact that the law hasn't changed, can we explain what that drop-off might be? It appears that maybe more people are asking for an exemption?
Yes.
Okay, so that seems to be, because clearly, based on your prior numbers, there's a huge drop-off in getting the vaccine. So given that the law has not changed, it looks like the major drop-off is just simply people not, or more and more people availing themselves of this exemption.
That is correct.
And presumably, I mean, can we surmise that if, I don't know the answer to this, but if we're looking at other states where exemptions are perhaps less permissive, have there been any comparisons to whether those states have seen pretty significant drop-off?
There are quite a few states that have not seen the type of drop-offs that we have seen.
Okay, that's interesting. Okay, thank you.
Senator Bullock?
I did have, it was one of my earlier questions, but now that Member Lipton has brought it up, with the drop-off and the exemptions, do we have data that says that kids or people are being treated more, folks are getting sicker, or has it been enough time to see that data?
Well, the measles map is, can I go forward?
So the measles is on the rise with all of these exemptions.
Yeah, the measles, oh, this is not the right slide. The measles map is one good indicator. We're seeing those measles numbers go up nationally in ways that we have not seen since the early 90s. And I would anticipate next year will be even worse. This map troubles me. We've managed to keep our measles outbreaks contained. Just across the border in Ontario, they had a measles outbreak with 2,000 measles cases. You know, schools were shutting down. It was really a huge harm to their communities. We have kept our outbreak numbers to 7, again, through a lot of hard work. But um, I would guess if we continue on the current trajectory that we're going to see some bigger numbers of measles outbreaks.
Yeah, thank you. That's, you know, I was just trying to make sure that we have a correlation to the trend of folks getting sicker, going to the hospital, causing more issues in the system. The hospital now is over, you know, all kinds of things. Do people have health care? We're trying to remove health care. Stuff we're not technically talking about at the table,
Yeah.
but there's so many other consequences from not doing what we're supposed to do.
Absolutely, Mr. Bullock. And you know, one graph I did not show here is we're seeing a similar increase in pertussis cases across the state. Pertussis is a cough that can be a hacking cough where little kids actually sound like they're choking or gasping, and it can linger for many, many weeks. So we've seen those pertussis numbers go up. We have seen that impact schools. And then one of the things we haven't talked about today is what this means for kids who are immunocompromised. So if you have a kid, for example, who has cancer and is on chemotherapy, who's had an organ transplant, they are depending on that herd immunity of the kids in their school around them. So it not only impacts the individual who's not getting vaccinated, but it can impact the community at large.
Thank you.
Any other, Dr. Pritchett?
Thank you. Back to the lead testing, just a question. If a parent takes their child to a physician and they're in a high-risk area, would the physician, just on a normal recommendation of blood tests, go ahead and run that blood test, or would a parent have to request it?
Yeah, we've been educating physicians in these areas, well, and beyond, about this requirement. So a physician that is in these areas, we're working to get sort of a standing order kind of approach, like, you know, asking about where you live.
All right, thank you.
Mr. McMillan?
Yeah, one more question. That first map, that school vaccination waivers, if you could put that up. So Dr. Bakhtarian, it says that it says school vaccination waivers. However, the colors in the different states show exemptions, not waivers. So what's the difference between a waiver and an exemption?
I think that this is just terminology being used nationally versus at the state level. But they are essentially the same thing.
There's no difference between a waiver and an exemption.
As far as I know, no.
Thank you.
Dr. Pugh?
Yeah, I just wanted to go back to the lead questions, but before I do that, Dr. Bagdasarian, you said that for the Hep B, the state of Michigan is recommending the American Pediatric, the doctors' recommendations. Okay, thank you. Just a couple of questions about the lead, where we are there, and asthma. So going back, I remember a while ago, well, when our hair was black, we were looking for Medicaid reimbursement for around asthma, as we saw with childhood lead poisoning. Did we ever get to that point? More so as it related to household remediation or looking at home.
So there is Medicaid reimbursement for nursing case management.
Yeah, okay.
For children with asthma in different places in the state.
Okay. And I'm not sure, but this is with the asthma, I don't necessarily remember seeing, as it related to what's going on to address asthma exacerbation or um, are there any school indoor air quality work that's going on in the schools?
So part of the Open Airways program is around that indoor air quality, sort of that low cost, no cost way of thinking about IEQ.
And then with lead, are we still seeing some of the remediation, lead hazard reduction programs that we we had back in the day? Have they expanded in any way? And then is asthma included in that?
So we do have lead abatement, lead inspection, lead abatement for residences. That is funded by both HUD and Medicaid. There's Medicaid reimbursement in some communities. So that would be homes. There's lead abatement in any community if there is a child who has an elevated blood lead level. There may be a cost sharing activity there. But then there are communities in the state where, and Michigan was the first state in the nation to do this, where we're able for households with Medicaid enrolled children or pregnant women in them to provide a lead inspection and then do lead remediation and abatement against hazards in that home. So that rather than waiting for the child to have ingested lead, if the lead's in the environment, we want to remove it from the child's access. So we have those programs across the state. They are part of, currently they are part of Medicaid reimbursement.
Okay, and I think just one more question as it relates to the filter first. And filter first, we're meaning filter water, not so much reliance on testing of the water.
Correct.
And are we doing, integrated into that, is there filter maintenance?
So that's part of the educational materials
Okay.
that goes along with that.
Okay. Okay, I think that's all. Thank you.
Thank you. I just want to make a couple comments. I'm a proud Rotarian. Rotary International worked very hard to help eradicate polio or to move in that direction, and done a lot of work locally in Dearborn. I was Dearborn Rotary president, and we were proud of Rotarians all over trying to make a positive impact. So thank you for the work you've done. I also want to mention I appreciate the comments on nurses. We have some outstanding nurses in the schools. I can speak specifically to Dearborn. I mentioned two, Carrie Kahn and Amy Candace in Dearborn. And I would just say that without them, through the pandemic and other things, we wouldn't have gotten through. Definitely, we need to look at, health and safety, and it's important to expand. And I think at the time, as local districts, we were making the best choices in mitigating different factors, but the nurses were essential, and they do great work. And I just want to also mention a shout out. My mother is a retired nurse, DMC Harper Grace, retired. So proud of the nurses. So thank you so much for your quality presentation. And we'll move on to our next presentation. Indigenous education, step into our stories. I believe they're coming up. This presentation will feature information on MDE's Indigenous Education Initiative. The Indigenous Education Initiative will highlight Step Into Our Stories, a culturally grounded learning bundle for educators that includes professional learning modules and community-informed resources developed in partnership with the Confederation of Michigan Tribal Education Departments, tribal nations, and indigenous communities. We're going to call Dr. Renee Garcia, Director, Office of Diversity, Equity, and Inclusion, Ms. Terry Rink, Director, Office of Special Education, Ms. Jen Huskin Lapointe, Initiative Director, and Mitarbeiterin, or one who works with, not does to, and Ms. Melissa Isaac, Jizwa Sood, or Protector of the Young. This is an informational presentation, and no action is required by the board. Thank you for coming to provide this information, everyone.
Good morning. Someone? Sounds quiet. Does it need to be closer? Oh, there we go. All right. All right. Meno Gijap, everybody. Good morning. Bujiun Dinaway Maganak. Greetings, relatives. Wabzikwa Indigenous, Name Dodem, Saginaw Chippewa, Keen, and Donjaba, Gijwasdu and Onungshe. As you heard, my name is Melissa Isaac. My Anishinaabe name in my ancestral language is Swan Woman. I am Sturgeon Clan, like the big dino fish that are in our waterways. I'm an enrolled citizen of the Saginaw Chippewa Indian Tribe, and my tribal nation shares geography with what we now know as Mount Pleasant, Michigan. I am a part of the Indigenous Education Initiative team for the Michigan Department of Education. My official title is Gijwasad. In my ancestral language, it translates to protector of the young. So in Anishinaabe culture, one of our cultural teachings is to introduce ourselves to new people in our most original way. There's a lot of familiar faces in the room today. Good to see everybody. However, this is our first time meeting Dr. Maleko, and I would like to welcome and congratulate you on your new role. And I look forward to continued conversation and learning about this important work. And to the rest of the board, good to see you again. As you recall, our Indigenous Education Initiative team was present during your meeting held at the Zewing Center on my ancestral homelands of the Saginaw Chippewa Indian Tribe. With me today are colleagues that support the work of the Indigenous Education Initiative and its commitment to Indigenous students. But before I hand it over, I got to give a shout out to Corey. We met Corey. I saw you sitting in here. All right, now I'll hand it over to my colleagues and let them introduce themselves.
Corey had us like live streaming with his students after we were with him the first time.
Yeah, and you're in my presentation today too. So
No,
there's pictures of
really?
that, so-
Oh, all right. Well, good morning, everybody. My name is Jen Hueskin-LaPointe. Dr. Maleko, kudos on getting Hueskin correctly. Nobody gets that, so appreciate that. My dad would be very happy. I do serve as the initiative director, but more importantly, my role and responsibility with the team is Mitarbeiterin, which in my ancestral language means someone who works to support others. And so Melissa and I do this work together every day on behalf of Indigenous children and learners and their families across the state of Michigan. And we're really excited to be back at the table. We were also with you in January. Apparently, we picked snow days to be at the table. I said to Renee this morning, how about June? Let's talk spring. But we're really excited to be back with you all today to give you an update on what we shared with you in January around the Learning Bundle, a collection of resources for educators that has been recently shared with our partners in education. I do want to take a moment to acknowledge our leader, Terry Rink. For those of you who've been at this table for a long time, you know her as the Director of the Office of Special Education. That is not how we know her. Terry is also the Michigan Department of Education Tribal Liaison to the Executive Office of the Governor, and she has been an absolute, don't get me all choked up, an absolute amazing leader for us in this work over the last, we figured it out, 12 years. Terry.
Try this one. Good morning, everybody. Welcome, Dr. Maleko.
Thank
We
you.
have all been anxiously awaiting your start time. Thank you, Dr. Carnell, for the support you provided us in the meantime. It was incredibly appreciated. Yeah, I have been the director of the Office of Special Education for about 10 years, but I've been with the department for 15. And somewhere along the 12th year, let's see, it would have been, drawing a blank.
The year?
Yeah.
14.
2014. I was asked to serve in the role as a tribal liaison. All departments of government have a liaison that represents each of the departments in the work that they do with the governor's office and to support the 12 federally recognized tribe. It has been some of the most valuable work I have done, and I've appreciated the work that has occurred and the folks that we've put together as a team. So we're excited to share with you some of the resources today that have come from that effort.
Great, and I'm Renee Garcia, the Director of the Office of Diversity, Equity, and Inclusion. And now I have a mic too. Thank you. Dr. Maleko, got to meet Jen and the IEI team within the first month of my time here at MDE. So I'm excited that you do as well within your first week, as a matter of fact. That started building our relationship. And I've had the opportunity to be in community with the IEI team, with CM Ted, working on this, providing feedback, learning, growing, listening, and I'm just excited and honored and privileged, really, to be able to continue to join their work and to connect them throughout MDE and with local educators. So show us where we are. So exciting.
Miigwech, Renee. All right, so I'll draw your attention to the image either on the screen in front of you or the screen in front of all of us. And I want to begin with an invitation. Step into Our Stories is an open invitation for all of us to step into an Indigenous worldview, one that understands learning as relational, land-based, and grounded in our responsibilities to one another. The digital art on this slide reflects that invitation. Here we see the back of a young Indigenous person wearing a backpack, looking out into the world. In front of them is new terrain. There's water, there's a turtle and a sturgeon, the land with the trees and grasses, and the sky with the birds, the sun, the moon, and the stars. The backpack that they're carrying is a learning bundle. Inside that learning bundle are tools, teachings, and resources that will help them explore and experience a different way of interacting with this new terrain, one centered in reciprocity, respect, and connection. This image is not symbolic by accident. It is the foundation of how this entire project was designed. For many Indigenous people, a bundle is more than just a collection of items. It carries teachings, stories, relationships, and responsibilities. A bundle holds knowledge that is living and relational. It is meant to be opened with care, shared with respect, and carried forward for future generations. Each item in a bundle contributes to the whole, just as each teaching contributes to a fuller understanding of the world. When we talk about bundles in the context of education, we are drawing on that same idea, a carefully gathered set of resources, teachings, and practices that are meant to guide, nurture, and sustain learners. It's not a one-off activity or a single lesson. It's a living collection that grows, deepens, and connects with the community. Step Into Our Stories is a primary example of community-driven education. When we talk about community-driven education, this is what it looks like. Step Into Our Stories was not built by seeking outside quote-unquote experts to explain the histories, experiences, or contemporary contributions of Indigenous peoples. Instead, the work was shaped and guided by the very communities whose stories it carries. Indigenous elders, youth, educators, knowledge keepers, culture bearers, language speakers, and artists, along with a small circle of trusted allies, co-created every element you are about to see. Nothing here is accidental. Every map, every teaching, every learning principle, every resource reflects deliberate choices rooted in relationships, sovereignty, and the responsibility we hold to future generations. The project stands as a model for how educational systems can partner with communities in ways that honor the lived experiences and uphold shared governance. What you will see today is not just curriculum development, it is the restoration of voice, perspective, and truth in places where it has long been missing. Everything you're about to see was designed that way. And so from the very beginning of this work, this was one of the commitments that you see on the screen in front of you that was absolutely non-negotiable. Indigenous knowledge systems would be the expert perspective guiding every decision. This meant we were not going to translate Indigenous stories, histories, or worldviews through a non-Indigenous lens, nor would we allow outside expertise to speak over the communities whose knowledge has existed since time immemorial. Instead, we centered the knowledge systems that have sustained Indigenous peoples, languages, and relationships to land and community for generations. By prioritizing Indigenous knowledge systems, this work was anchored in the teachings, philosophies, and ways of learning that come directly from Indigenous communities themselves. It shaped who has been invited to the table, how we built and strengthened relationships, how we defined success, and even how the learning bundle was structured. This principle was not an afterthought or something we added midway through. It was the starting point. It was the guardrail. It was the promise we made to Indigenous communities that their knowledge would not be supplemented, interpreted, or validated by outside expertise, but honored as the foundation of the work itself. Holding to this commitment is what allowed Step Into Our Stories to remain authentic, culturally grounded, and community-driven from start to finish. And so now we're going to dig into the website and start to explore a little bit. And so what I want to, oh, we see it here, but we're going to get it on the screen in front of you.
My turning on the mic was the height of my tech support.
Oh, outside of the presentation, maybe?
Yay.
There we are.
Whew.
All right, well,
You did it. There you go.
welcome to your learning bundle. This is your official invitation to step into our stories. This learning bundle was created for all of you from all of us. Throughout the learning bundle, you will see those yellow buttons on the side there. One is a blue jay feather, the other is a loon feather. Each represents a dialect of Anishinaabemowin or Anishinaabe language. You can click on each to hear a sample of our beautiful language.
Mampi ia jig kina minwa, mandaga minem kanagaya ia jig.
Guki Jichka Gom.
And both of those are ways to describe from all of you, from all of us. So before we watch the 11-minute mini documentary titled In Our Own Words, I want to preface everything we're going to see here going forward. The goal in creating these resources is to help educators confidently and effectively teach about Indigenous histories, cultures, and contemporary contributions. The understandings shared here reflect one perspective rooted in Anishinaabe thought and are offered to support learning and relationship building. Indigenous knowledge is not fixed. It is lived, practiced, and passed down in ways that vary across families, communities, environments, nations, and regions. These explanations do not represent all Anishinaabe or Indigenous worldviews. Whenever possible, make space for and prioritize community-specific language, teachings, and guidance as they are generously offered.
What does it mean to belong to this land? To carry stories, language, and memory while moving forward? This is not a history that ended. It's a history still living in us. For generations, Indigenous voices were excluded from how Michigan's history was told. But across the state, educators and tribal citizens are building something new, together. They welcome you into this space as relatives in the hope that we can collectively change the way we teach Indigenous histories, cultures, and contemporary contributions. Together, we can foster learning environments that honor Indigenous ways of knowing, teaching, and connecting.
It wasn't any one thing, it was a collective of so many of us wanting to know more, some of us having the knowledge and wanting to share, a multitude of educators, community people. Actually, it was a product of our boarding school survivors and them wanting to tell their stories too.
I had never learned about my own people until I started working for the tribe. For me, it was an important thing for Indigenous students to learn where they came from, what did their ancestors go through, and just learning that sense of belonging.
Telling a more honest story means shifting how we teach and how we listen. It means making room for more than one truth at a time.
What we're really asking people to do is have a worldview shift. We're asking folks to broaden their perspectives too. When I think about history, the way it has been taught in my school systems, even into higher education, more often than not, we teach history in a way that's black and white. This is the truth. And if it's not written in a book, then it's not true. Truth is perspective. You can stand in a circle and witness the same event happen, and depending on where you're standing in that circle, you might see something different, and both of those things can hold true. And that's, I think, part of what this process is happening too, is that we're asking educators, learners to broaden their perspectives to understand that, well, yes, this one part of history can be true, so can these things too, and inviting people to look at beyond what's just written in a history book and broadening those perspectives and stories that are often not included in our histories that are taught.
Before we can even begin to teach about those important parts of history, we have to create a foundational understanding of who we are as people, that we do still exist today that we live, work, play, thrive on this land, and that we are sovereign tribal nations interacting with the state of Michigan. The way that we're going to do that is through the creation of essential understandings. What does every citizen, not just students, but every citizen in Michigan, what do they need to know and understand about Anishinaabe people before you can go any further? And so through community and engaging with Anishinaabe people from all over what we now know as Michigan, we've created 15 essential understandings. These are the 15 101 basic things that you need to know about Anishinaabe people in our state. Even that alone, if students get through our K-12 public education system and they are familiar with those things and understand them, that's a generational impact, and we're really looking forward to that.
It's a depth of knowledge. So somebody that could be 35-year-old coming in at the awareness level is at the same level as maybe a 12-year-old. But it's just because where they know how deep into those teachings they can get.
The framework itself is an invitation to come into our worldview to see things a little bit different. It's very experiential. It's about relating to things, learning by doing. That's very much an indigenous knowledge system principle.
We're tactile learners, Anishinaabe are. That's one of the things that we want to kind of give them experience in. So everything we do, we kind of have a EE experience, like experiential education. So that way they're learning the same way we would have to a certain degree. They're seeing outside of the box, you know.
In Anishinaabeg ways of learning, relationship is the foundation, experience is the teacher, language is the vessel, and stories are the bridge between generations.
As we had a speaker talk about boarding schools, and then we did a activity where we were standing on different parts of a blanket. We were talking about the land, being taken away, and as the land was taken away, we had to go away. We had to be silent. And as I was standing there, it really began to bother me that I didn't speak up and use my language to introduce myself, because I thought of all of the boarding school kids who lost their language and who couldn't speak it. And here am I, a person who can speak it, and I chose not to. And so it kind of, struck my heart, the importance of speaking the language when I can. And so when it came time for my part, I said, wait, and I said, Michelle Sims, Indigenous Cause, Mukwan Dodam, Anishinaabe, Keenan Dojaba. And then I told them why that I did that, because when that was taken away, it was kind of like when the kids from the boarding school were taken away and they weren't able to speak their language. And so I had to stand up and do it right then, because I felt like I needed to do that, because it's important. If I can speak it and they couldn't speak it, I needed to do that.
When we think about the importance of language being so tied to who we are culturally and as a people, without our language, without our culture, we're not different. We are the same, and that's what distinguishes us and makes us different. Ani Bushu, Anishinaabe Odawa, Kwe and Dawa, Waganaxi no Dawa, and Doda Pendagwas, Neme and Dodam, Jordan and Dola Jaganashi Nozwan, Anishinaabe Aki and Donjaba, Kinamage Kwe, and Donanje Nahau.
Wabzikwe Indigenous, Name Dodam, Saginaw Chippewa, and Donjaba, Gishwasado and Onangshe.
Buju, Makwan Indigo, Minwa, Aaron Chivas, Indigenous, Mikizi and Dodem, Washinang and Dojaba, Minwa, Kichi Wikwirong and Dida, Kinamage and Nina, Minwa, Shkabe was in Nene and Dao.
This work is about more than curriculum. It's about healing, it's about remembering, and it's about creating space where Indigenous students and all students can see themselves.
Big reason why some of our people, the Anishinaabe people, don't know those teachings or our language, because it was taken away. We're trying to cover those areas that you definitely don't hear about. I mean, like I said, things have picked up the last few years, but I wouldn't say that there's a grand scale of the population in Michigan, much less the U.S. or Canada, that know a lot about some of the things that are covered within the curriculum.
We brought together a group of allies, classroom teachers, administrators, superintendents, people from the Michigan Department of Education. What do you think of this? This is the direction we're going in. Here's the experience of what we're trying to convey through these professional learning modules and these lesson plans. And the feedback that we got was great. It was transformational for a lot of people. We had a student who just graduated high school in the mix and she was upset because she couldn't believe that she got all the way through Michigan's, K-12 public education system, had not heard any of what we were talking about, and wondered why. And she felt like it was unfair. And she's right. It was unfair. It was unfair to her, and it's unfair to all of the students who are currently going through that system who don't receive Indigenous, histories and stories. And so I thought that was a success as well, because we actually got to hear from our young people the things that they deserve and want in their educational experience.
This is just the beginning. Across Michigan, Indigenous educators and allies are reshaping what's possible by telling the truth, teaching with love, and building something that lasts.
What we're doing right now is creating a really important foundation for Indigenous education, not just Indigenous history, because the things that we're designing, from the essential understandings to the learning principles to like this awareness, understanding, and truth framework, it's not just relevant to history. It's relevant to all principles of learning, whether it's science, language arts, world history, or so many other things. And so for me, in a long-term success would be to see this work and the learning principles and the essential understandings, again, the foundation that we're creating, to be built out for the multiple disciplines, not just history. That's my, the big win.
This is what's going to help build so that when we're gone, the next group will build on, what we're doing to just continue for the kids to learn and people to learn and understand.
It's awesome because like they're retracing who they are, reconnecting. They might have got adopted out, or they might have, this, that, or other. So it's cool that to be able to help those that may not have anywhere else to turn, or may not have another way to uncover that. So there's a couple different things that I think moving forward, our children will be able to, hey, that's cool, that's who we are. It's something that, like I said, building that identity, building who we are, and so that way, hopefully one day down the road, we don't have to make stuff like this because just all of us know.
Everyone deserves to know and understand the history and stories of the land we all live, work, and play on.
You'll notice at the top of the website and then at the end of that video, there's two logos there. One is for the Indigenous Education Initiative, that's who we are. But we also talked about how there are tribal liaisons for each state department. There is also a tribal consultation policy for each state department. And the MDE's tribal consultation policy is a collaborative governance model. And that group that we collaboratively govern with are the Confederation of Michigan Tribal Education Departments, where each tribal education system, all 12 federally recognized tribes have them. They all look very different, but they all come together, and that's who we co-govern with. And so I just wanted to bring that. They're an important part of all of this work. The next thing on the website is an event. Anytime there's an event coming up, we invite you right here to sign up for this, our first event, so it'll be exciting. And it'll be a walkthrough, a more detailed walkthrough than what we're gonna go through today of the Learning Bundle. So please register and join us Wednesday, December 10th from 4 to 5:30 Eastern Time. The next thing on the website is a learning module. This is the actual invitation, and it is an interactive module that you can go through and will come up on the screen. It's free. Educators who wish to receive sketches, we've arranged for that so that they can do that. but we didn't want to create barriers for any community members who are interested in learning. And so it is open for anybody to view. You don't have to be a certified teacher. You can be a certified teacher and get credit for it. So we try to eliminate as many barriers and give people credit for the learning that they're doing. The next thing is this bundle that we're talking about, that backpack, that thing that carries all the resources and tools. We're going to dig into that and go through the components of that. There is what you can see on the screen now. You can click on those, but there's also a tab at the top that'll pull them all together so that you can see them all in one place. What we're doing is encouraging folks to first go through these grounding documents. These grounding documents are going to set the foundation for everything else that you see in this bundle. And the first thing that was developed by the community and all of the folks that you've been seeing in the images and the videos are what we're calling Anishinaabe learning principles, almost like best practices for how to teach indigenously. This represents how instruction should happen from an Anishinaabe worldview. There are 7 learning principles that guide educators in creating learning environments that reflect Indigenous ways of knowing through relationships, land-based learning, and experiential practices. These principles are good for all students, not just Indigenous students. And so this is who this was created for. Those 7 learning principles are everything is connected, language is a pathway to understanding, storytelling, the heart of knowledge, learning through kinship and community, the land is teacher, learning through experience, and honoring those before and after us. Each of those are broken down further, as you can see, translated in our language. And we let educators know, we let the citizenry know, why does this matter? We also talk about what this looks like in practice, so what it might look like and what it might feel like. And then further, oh, just those things. Yeah, each one has that. So I encourage you to dig deeper into learning what those are about and kind of what they mean. The next thing is what in our language we refer to as babinskamat. And this is the cyclical nature of learning. Babinskamat actually translates to like a whirlwind where things kind of circulate. This is a learning framework that describes the practice of circling back to reflect and grow. And so once we learn more about a topic and we come back to that beginning introductory, we're going to see it differently because we know more. It's just a natural occurrence of how learning works. It reminds us that learning is dynamic, that it's a lifelong journey and always evolving and never truly complete. We can always revisit things and see them in a different way. And as you scroll through each of the pages, it breaks it down. So you heard in the video as well, awareness, understanding, and truth. Awareness is for the folks who, in this day and age, don't know that Indigenous people exist or that there are tribal nations in Michigan. We welcome that. Come on in. We're gonna teach you. You don't know what you don't know, and that's okay. So we bring people in at the awareness, or maybe they've heard a little bit, but they're not really quite sure beyond knowing those 2 facts, for example. So we continue to build their awareness on that particular topic. There's a level that we refer to as understanding, and that acknowledges and thoughtfully reflects on the complex histories and lived experiences of the Anishinaabe. Our history gets more complex the further you go into it, and in our communities and with the folks that we were working with, you saw the boarding school images, those are tough. But we don't want to just like slap people on the side of the head with that hard truth right off the bat because, whoa, like I didn't know what I don't know. And so let's introduce that and build upon it before we get to that level. That's what understanding does, is it builds on, now that you have that foundation, we're going to build up on it. And then we're eventually going to get to what we call the truth level, where we center Anishinaabeg voices, acknowledging harm and guiding learners toward reconciliation and equity, meaning now it's time for those hard truths. And now we have a responsibility with any learning that we do. Once we know, what are we going to do about it? What are we going to do with it? And so that is the overall description of that, but I do encourage you to dig in deeper so that you can learn more about that. The final foundational document we've also referred to as Essential Understandings for Michigan. These highlight key concepts about the histories, cultures, and contemporary experiences of Indigenous peoples, and these can help educators teach accuracy, respect, and connection to the communities whose stories continue today. There are other states who have essential understandings. Sometimes they're called enduring understandings. And one thing that we wanted to be, that differentiates Michigan from the other states is that those standards start, those understandings start with the onset of colonization and they go forward. But we know that we were here before the onset of colonization. That's important for people to know. And so you'll see things in here like sharing and generosity, sacred relatives, our sense of humor. Those are all very important things about Indigenous people that you should know. And I always use this example, and it might be like this in other cultures, but I know when, you walk into a funeral, it's pretty somber, right? There's people that are grieving and emotional. If you walk into an Indigenous community funeral, you're going to hear laughter, and they're probably roasting the person that passed away because they said something funny or did something funny. And I thought for a second, like, if somebody walked in here that didn't know that and they heard us cracking up and doing all these things, I think it would be kind of a foreign situation. And so that's in every gathering. If you don't hear laughter, something's wrong. Like, you should probably look and see what's happening, because there needs to be laughter there. So those are some of the examples of how we started pre-colonization, about who we are, and then we move forward. And this is the basic foundational understanding. If every single one of us knew that, what's here, if every student understood all of that, I think the relationship that has been historically strained between the state and tribes would look a lot and sound a lot different for the positive. And so that's what we're hoping to convey through the essential understandings are, here's the baseline, here's what everybody should know. Each of them, so this is layered with learning. So you can see those symbols. What we thought we would do is kind of systematize these. And we're like, what image could we use? What makes sense? We're working in education. This is what this is for. And so we dug into the treaties that included provisions for education. And our ancestors signed those treaties, but we didn't have, the alphabet to be able to sign a name because our names were different, but we did have symbols. And so each of these is a signature mark found within the treaties. Now, that was a learning experience because I'm like, we need to find 15 treaties that have a signature, but there's like 80 signatures on one treaty. So we learned very quickly. So we looked, and some of them were the same. So, for example, the sturgeon, I said I'm Sturgeon clan. You can see the sturgeon there. That was one of my ancestors' signature. They left a sturgeon because that was their clan. There's a lot of people who are Sturgeon clan. And so what we did was asked an artist to do a rendition of these signature marks. They didn't look exactly like this. They were more like an icon, like iconography. But we had an artist because we thought, whose relative are we going to choose to replicate their signature for this? And how do we get in touch with the family to be able to ask that permission? So we had an artist come in, an Anishinaabe artist, and say, here's screenshots of all of the treaty signatories. Choose the ones that speak to you. And so each of these is reflective of one of those treaty signatures on the educational treaties that Michigan has. The next thing, after you get through the grounding documents, are the are the learning modules. These modules invite you into a learning journey and can transform how we learn, teach, and live in relationship with one another. They are open to all community members, educators, and anyone curious to learn. Educators and others seeking sketches can earn credit by enrolling in the module through the continuing education page. So there are two so far. As you can see, an invitation to teach through an Indigenous lens. And then there is also learning together, and that's those Anishinaabe learning principles that we mentioned earlier. So you get the booklet, and then you get this learning module to kind of reinforce that.
And then in the first module, the Learning Together, it gives you an overview of the essential understandings and Babinskama, the cyclical nature of learning.
Also developed are a series of lesson plans. And the way that the group decided to do this was, okay, we have these essential understandings for you. You can read them, but let's put some context behind them and what they actually mean through an Anishinaabe worldview. So these are scripted lesson plans. Again, you don't know what you don't know. So you hand an educator a lesson plan on a foreign concept and expect them to teach it. We wanted to make this as accessible as possible to guide both the educator and the student on their learning journey through the essential understandings. So we often look to teachers as the experts, but when we're talking about things we've never seen before, then we also have to situate ourselves as learners. And so this situates the learner and the teacher, or the student and the teacher as learners. And these are all at the awareness level, that foundational level that we talked about. Sure. We'll let you see what's in here. We included all of the PowerPoints, the PDFs. Teachers shouldn't have to purchase, or a district shouldn't have to purchase a whole lot to be able to do this, maybe to print off things if they don't have access to electronic things. But you want to do the whole lesson plan? Okay.
Here we go.
So this is what a lesson plan looks like. It has the title, it has the EU that it represents, it has that signature mark, and this particular one is about citizenship and political affiliation. And these are all framed the same. So whenever you open one, you're going to get the at a glance with the explanation, a little bit more about what you're going to need. So we have essential questions, we have learner's will statements, logistics, where does this take place, the time required, the materials required.
And those are all provided.
Yep, those are all provided. And then the engagement piece, the learning experience piece.
Scripted.
Which one? The reflection piece, to make meaning from everything that you just learned. And again, it's all scripted. Tells you when to pull up the PowerPoint. And then the last is a call to action. Tell your friends about this. Tell your families about this. Share what you know. And then a language appendix for things that maybe aren't familiar or people have different meanings for. And then if there's any of our language woven in here, it has the glossary for that. Now, citizenship and political affiliation is a huge topic. And so to be able to teach this, we knew that teachers were going to need some background context, additional information. This part is non-student facing, but it gives the teachers the background they need to be able to, oh, okay, this is why we're doing this. And it helps it make a little bit more sense. And so we have these for every lesson. Again, key concepts that we talk about, why it matters, why it's important. So right now there are 5 lesson plans on there. The next 5 are coming soon. And then the last 5 will also be uploaded as well.
One for each EU.
Yep, there'll be one for every of those 15 EUs. The next thing is the literature guides.
Oh, I hopped ahead.
Yes.
Sorry. She's like,
I was going to try to wing it. I'm
wait.
sorry.
No, you're okay.
All right, the next thing we have are maps. Now, a cartographer did not make these maps. We had an Anishinaabe artist do it. And there was, again, intentional. The maps most of us are used to seeing were created by outsiders, colonial governments, institutions, or publishers telling our stories for us. These maps are more than a chart of boundaries. They are a way of declaring who we are, where we come from, and how our stories are connected to place, shifting the narrative from others defining us to us defining ourselves. So this first map is titled Before Borders, and this is Anishinaabe, or Land of the Anishinaabe. This was created by an indigenous artist, and this map offers a view of the land as it was known before colonial borders were imposed. It reflects the deep relationship between the Anishinaabe and their homelands, reminding us that identity and place are woven together. This map supports teaching about history, sovereignty, and the continuity of Anishinaabe presence beyond imposed boundaries. The next map, Promises on Paper, How Treaties Shaped Michigan. This was created by an Anishinaabe artist as well, and this map shows how treaty making reshaped relationships between the Anishinaabe and the United States. These agreements altered Anishinaabe ancestral lands and allowed Michigan to become a state. The map offers a visual way to understand how treaties continue to shape history, sovereignty, and responsibility today. And so you can see those signature marks again, because this was established through treaties on the side there. The third map we call Seats of Sovereignty, and these are the 12 federally recognized tribes in Michigan. This map, also created by an Anishinaabe artist, invites learners to see Michigan through the contemporary lens of tribal sovereignty. Each seat of sovereignty marks where a tribal nation cares for its community and territory, honoring responsibilities that have been carried forward for generations. The map affirms that enduring presence of the 12 federally recognized tribal nations across our state. We'll go to the literature guides now. Yep. So this is probably the most requested item we get asked for when we're out in community. And we realize very quickly that there are a growing number of Indigenous authored books that are highly recommended, and learn just as quickly that educators needed support on how to incorporate these stories into practice. Jen's gonna pull one up and go through those components.
So we actually have a hard copy of this one too. This one is recently added to the website. The book is entitled Braiding Sweetgrass for Young Adults. So if any of you are familiar with braiding sweetgrass, the author has created that book, but there's also been a version of the book for young adults. And as Melissa mentioned, the literature guide are probably the things that we get asked about the most, because they want to have the books, but then they don't know what to do with the books. And so the literature guides are built to support educators, librarians, community members utilize the literature. And again, it's all aligned with those grounding documents, the Babinskamat, that cyclical nature of learning. So it takes you through the same book, but at deeper levels depending on the lesson that you're working on. Each literature guide has a summary, so you know what the book is about. It talks about different themes that you should note as you're going through and using the piece of literature. So those descriptions and themes are identified in each guide. Words to learn. So this is similar to the backgrounds for educators and the lesson plans that have those words that just might come through as an important piece to be teaching through that activity. Every literature guide has essential questions, experiences, and reflections. And again, they're aligned against that cyclical nature of learning, that Babinskamat, awareness, understanding, and truth. So we had a question early on in development. We had a picture book. Can you put water protectors? One of the books that we had identified, the team had identified, is a book called We Are Water Protectors. And we were going through this possible activity with educators in Michigan, and we had a university colleague who said, I'm not trying to be difficult, but like a high school teacher is going to use this. And we had a upper middle school teacher in the room and said, this is like my reward for good weeks in my classes is to go into children's books. And so just this idea that you can use different types of literature that aren't age bound. I don't know if Melissa mentioned this yet, but when you look at the materials, the grounding documents, the lesson plans, all of that work, nothing is by grade band and nothing is identified specifically to a thread or a discipline, social studies, English language arts, math. That's intentional, because the framework that we're trying to build is that cyclical nature around awareness, understanding, and truth. So it doesn't matter your grade. I have a 84-year-old mother. She is at an awareness level. We also talk with 7-year-olds that we work with in community who are ready to have conversations about the hard truths. So it doesn't matter the grade or the age, it's really about where they are in that understanding. So every literature guide has questions and experiences based on that awareness, understanding, and truth level as you go through. Glasses.
All right, the next component are the essential understanding posters. And again, those 15-101, we have created posters for educators to put in their classrooms, schools to put in the hallways, The state board to put, looks like a nice little spot would fit over there if you wanted to hang one up somewhere, in your office, if you, wherever you want. And these are just like a high-level overview of what those understandings are, and in our language as well. And then the last one. All right. You saw in the lesson plan the story behind the teaching, that additional context. We felt those were so important that we needed to pull them out of that lesson because it's a lot of pages, right? Pull those out and make them accessible for people to engage with. And so they are separated from the lesson plan, but are still included in the lesson plan in this particular tab.
Slides. I'm a Mac person, y'all. So I'm very happy for the support.
Yep, right down there, yep. And we have 2 more slides after this. All right, so Jen.
So just a recap of what you've just seen on the site. This is a quick view of the learning bundle. So when Melissa started talking about the little girl with the backpack, or the Indigenous child with the backpack, these are the resources that are in the learning bundle for educators and community members. So we talked about professional learning opportunities like the webinar that's coming up tomorrow. You still have time to register. The lesson plans, the learning frameworks, those grounding documents that we talked about, the literature series, and then we're in the process of also developing a podcast series, just as a different way for educators and community members to hear about the work in a more conversational, relational way. One of the things that we've heard is, I don't know if we even said this, but the website itself, the resources have only been recently made available. So September 13th, it was a Saturday, we introduced all of these resources in Community First, which is the way that it needs and should always be done. And as we were starting to roll this out and we were talking with different groups that we were talking about, tribal leaders, state leaders, they're like, oh, this is amazing, like all this work, and here it is. And somewhere along the way, we got the perception back that they thought that it was done. And we're like, oh, no, no, no. So we created this visual. The EU at the top are those 15 EUs, and then you'll also note the orange heart on the far right of the screen. That is specifically for the work that we're doing with boarding school survivors. It's a component that's very important to the work. It was part of where this work was rooted from. That work is happening. We have been working with a group of survivors, and at this point in time, their request is that we keep that with us for right now. So that work is still coming. But you'll see that the understanding and the truth rows still have a lot of work to do. So just wanted to give you a visual that it's a start, but there's still a long way to go.
All right. So in the spirit of reciprocity and relationship, values that are at the heart of how we teach and learn in Anishinaabe communities, our team would like to share something with each of you. In Anishinaabe culture, when a gift is shared, it is not simply a transaction, it's a relationship. A gift carries a teaching and a responsibility. It says, I see you, I honor the relationship between us, and I trust you will carry this forward with care. You are getting learning bundle boxes, and we know that they are more than materials. They carry teachings, artwork, language, and resources created by tribal educators, artists, and culture bearers. They're an invitation to listen deeply, to learn alongside us, and to walk this path together. By accepting these bundles, you are accepting the invitation to step into our stories. As partners, as learners, and as people committed to a more truthful and connected future for Michigan students. And we hope you enjoy and share with your kids and your grandkids and softball teams, Girl Scouts, Boy Scouts, whoever you're. Yeah, hockey. Yes, there we go. That you can both learn from this and then share your learning with others.
Thank you. Thank you. Appreciate the very detailed presentation. do board members have any questions? And I'm going to try to make up a little bit of time as we go into lunch with the delayed start. But if there's any questions from board members. Senator Bullock?
I don't know if I have like a question. I got more commentary. I'm just excited about it. So as a black man in this space who's always trying to learn more and more about my own culture, I grew up a Boy Scout. I'm an Eagle Scout that spent a lot of time throughout the state of Michigan in a lot of indigenous places in the state of Michigan and the tribes and things like that. And then at some point, I became the chair of the Michigan Legislative Black Caucus. And so black and brown communities of all sort I've had to defend, but just excited about how this is. And as we advocate on occasion for African-American curriculum, which is in some places, Detroit, but we've been trying to get it mandated for a while. And so all of these things just make me feel good. I'm excited, and then using your spirit names. So I've been blessed with and given a spirit name. And so it's the Tanka Yatanka. I'm named after Sitting Bull. And so I don't use it as much because nobody knows how to pronounce it or say it. But I always put Sitting Bull on everything. So people ask, I didn't get to give the story.
Sure.
But I also give the story of my people going through slavery back to Africa and how we got our names and where those names come from. And so it's just warming to hear more and more and get more and more information. I used to live in Albuquerque, New Mexico. So all my friends were, so like Tao, Tiwa, but their name, so they gave me the information about why they don't use reservation, they use Pueblo. So, and all of those things, the Spanish word for village and all that other stuff. So then I've been to South Dakota, I've been to the Black Hills, I've been to Crazy Horses Monument. So I'm just feeling good about your presentation.
Miigwech, thank you.
Anybody else? Ms. Lipton?
Thank you for the presentation and for the bundle.
And I accept.
I'm just curious, I'm not suggesting more work, but have you given any thought to integrating any of these materials and teaching styles into early education or even early education providers' preparation programs? Because it seems to me very, very powerful, and that not only would it be important for those people who identify as indigenous, but also really for everyone as an American to know.
No, it's a great question. I think part of when the appropriation originally came through, we were kind of just getting ourselves oriented to what this might be. And as the work progressed and we were having the conversations with our Indigenous educators and language speakers and community folks, that's how we got to that grounding documents piece, because it is so universal. It's not specific to grade. So concepts like sharing and generosity, language, those are all conversations you can have with 2 and 3-year-olds, younger even. So I think that's some of the beauty of how it evolved from this really kind of curricular, has to follow this framework, into this really truly indigenous-based way to think about it. So we have one of the tribes right now that we're in conversation with, that they are thinking about putting those learning principles in place into their preschool. They want to have that conversation of what could that look like. It's why some of the materials are organized like, it might look like this, it might feel like this, it might sound like this, so they can make it their own. In terms of the conversation about educator prep, Renee gave an example for her office, and Terry referenced this. IEI serves all of MDE. So we work across all the divisions, all of the offices, and we have a really, really amazing partnership with the Office of Educator Excellence under Kelly Borzanski's leadership. That's how we got to know Corey and Squat and wherever else they all are. To have that conversation about how do we have conversations with not just getting this in the hand of current educators, but how do we get these materials in place for those that are studying to be an educator? The biggest thing we hear all the time is, I never knew this. We heard it from kids, but we've also heard it from all the adults. I didn't know. I've literally had no exposure to this. And so getting into those pre-service programs is a priority too. Yeah. great
Wonderful,
question.
thank you.
Dr. Pritchett?
Thank you for the presentation. You have thought through so very well about how I, as an educator, the educators out there would now begin to approach this and taken away some of those hurdles. And so I appreciate that. And now I have to put a plug in for the Detroit Institute of Arts and their special exhibit that is currently very active on the Anishinaabe artwork. Those of you who have an opportunity to get to the DIA, and I'm not sure how much longer it's going to be up there.
I thought it was April.
April.
Yeah.
I highly recommend it. It is very well done and was in collaboration with the tribes in Michigan. So.
Yes.
You'll be happy to know we're in conversation with their education staff as well.
Okay.
They have the box.
Okay, well, thank you very much. We really appreciate the high-quality presentation and the support for all of our students here. Thank you.
Yes. Miigwech, everybody. Bamapi.
Next, we have the report of the Teachers of the Year presentation. We're going to welcome Mr. Corey Rosser, 2025-26 Michigan Teacher of the Year, Social Studies, Quest High School, North Branch areas from North Branch area schools, and Miss Deidre LaPointe, Region 8 Regional Teacher, Elementary, Luther C. Clagger Elementary School, Manchester Community Schools. Thank you for being here and providing a presentation.
Hi, thank you for having us. I had the pleasure of introducing myself to the board and to Dr. Rice and Dr. Carnell, and so I'll briefly introduce myself to you a little bit. So I work at Quest High School. It's the alternative school at North Branch area schools. There I serve as a teacher and the program coordinator as well. I serve, like a lot of our teachers do around the state, I serve in a variety of roles. We're a small district, and so we wear a lot of hats. And so I coach basketball, coach baseball, run our GED program, our summer school program, several other programs as well. And so I'm going to allow Deidre to go ahead and introduce herself.
So I graduated in 2004 with a bachelor's in elementary education from Central Michigan University. Then have my master's from Walden University in reading and literacy. I have 13 years completed, so this is my 14th year in education. I've had a really rich volume of experiences within that. So I've taught for 2 years in Southeast Michigan in Berrien County, GSRP preschool, then taught 5 years in the Grand Rapids area in GSRP preschool. And now I'm in like more Southeast Michigan, teaching. I've done kindergarten first, and now I'm in 3rd grade. So just a little bit about my life in my district. We are a very small district in Manchester. So that middle picture is our entire student body for the whole district at Halloween last year. But it also gives us a lot of opportunity to do some really cool things within the community. So all the way to the right, that is part of a project we did with our Title I summer school this year. We took daily walking field trips to different businesses and community providers within the community in Manchester, and then we wrote, the kids actually wrote articles, so they were like student journalists from kindergarten to 5th grade that were then published in our Manchester Mirror, which is just a very small newspaper.
If you look at the demographics of our two districts, while our district pulls from a wider geographic region, so we have more students, there's actually a lot of similarities. We both have a very homogeneous district in terms of our demographics, and financial aspects are a struggle in both of our communities.
So today I'm here to talk to you about the need for trauma-informed schools. In trauma, here we're going to define as an emotional response to a terrible event like an accident, crime, natural disaster, physical or emotional abuse, neglect, experience or witnessing violence, death of a loved one, war, and more. That's the definition from the American Psychological Association.
So the quote that I have from our school social worker at North Branch starts is, as a high school social worker, I see every day how trauma shapes students' ability to learn and engage. And I'm just going to summarize the rest for you because I think it really is a universal truth that all school employees understand that if you want to educate the whole student, you have to acknowledge the whole student. And we don't let some of the past trauma be an excuse for future educational performance. But if you really want to educate the full student, you have to acknowledge the full student. And our students come with many different traumas. It seems to be increasing year by year, the different experiences they have. And we've got to help them deal with those different adverse experiences in order to get the most we can out of those students.
So here we're going to talk about adverse childhood experiences, or ACEs, which is typically how trauma is measured, or kind of put numerically. Adverse childhood experiences are potentially traumatic events that occur in childhood between 0 and 17 years. The effects include poor health and well-being into childhood, or in childhood, lack of opportunity into adulthood, an increased range of a wide variety of chronic diseases, leading to death. This is the ACEs questionnaire. There's a lot of information on that slide, so I will not read it to you. But there are 10 basic experiences that are considered adverse childhood experiences. This is a questionnaire that's used with adults, not with children. So domestic violence, substance abuse, any type of abuse or neglect, even just parental separation, incarceration of a parent or guardian. And unfortunately, these are very common. Most adults, regardless of their background, have experienced at least one in their own childhood, and more than a tenth have a total ACEs score of 4. And a score of 4 doubles their risk of heart disease and cancer, increases their odds of becoming an alcoholic by 700%, and their risk of attempted suicide by 1,200%. So all of these things then also lead to higher risk for their children, so it's a generational effect. In a 2023 study found that 3 in 4 high school students reported experiencing 1 or more ACEs, and 1 in 5 experienced 4 or more. So why this matters? This is a student from my very first year of teaching, and I had kind of gone into education feeling very prepared for my teacher preparation courses and all of that. And then I encountered this student towards the end of the school year. This is a preschool student, so he was 4 years old at the time, and had experienced things I could never have imagined as an adult. He couldn't tell us most of those because he was almost completely nonverbal still at 4. Spent a lot of time hiding, a lot of time trying to adjust the environment to what would be more comfortable to him, which meant a lot of time kind of destroying my classroom. And I so immediately was like, okay, I'm out of my depth here. I need to learn more. So he is kind of what prompted me to learn more about ACEs and more about trauma and what that looks like in the classroom and how to support students. He also happened to be in foster care at the time, and the following school year I adopted him. So here he is last spring, graduated from high school, so broke all of the things that we talk about with risk. Very, very proud, never stops talking now. So he got over that with a lot of speech therapy. But it also took a lot of really powerful educators. It took a lot of advocating, both on my part, from other educators in the special education realm, and to be able to support him to get through school, because what we were finding was that it was just the typical classroom wasn't what met his needs. Now he is, like I said, graduated, was really down to the day, but he did it. And he's now attending MCTI for trades, so that's very exciting. But just kind of one of those success cases, but again, that took a lot of love and a lot of heart and a lot of work on my part and on the part of a lot of educators. So what the impacts of trauma are in the classroom. trauma basically impacts a child's ability to concentrate, organize, and process information, which are pretty much all the things we need them to do to be able to learn. So again, like Corey said, we really have to look at the whole child, not just the content we're trying to get them to learn. And then the effects in the classroom, students affected by trauma can range a lot, but experience difficulty with memory, language development, and writing, respond fearfully to people and situations at school, even long after the event has occurred. So my son, for example, he has had a relatively trauma-free life since about 6 years old, still has some things that trigger him, right? Those are kind of built into the way his brain operates at this point. Have difficulty with peer and or adult relationships. I have read somewhere, and I don't have it quoted here, but it takes about 8 months for a student who struggles with building relationships and with attachment to build a relationship with a new adult. So pretty much the whole school year. So it really takes a lot of intentional work on the part of teachers and administrators and all of that to support these students. And lack the ability to self-regulate emotions, behavior, and attention, resulting in responses like withdrawal, aggression, or inattentiveness. And then all of those things are things that can get us ejected from a classroom. So really it's important to support teachers in understanding how to support students. Mostly important because schools are the single point of connection between home life and community dynamics, and the responsibility of educators to prepare young people to function successfully in the world as adults can only be bolstered with a trauma-sensitive approach. For lots of people, for lots of families, the biggest area that they get support from is from schools. So having school social workers, having mental health professionals that can work with the schools, having student support personnel, all of those things support not only the child but the family as a whole. And some things that are commonalities in staff in trauma-sensitive schools is they share an understanding of how trauma impacts learning. Like Corey said, we're not going to use the past traumas as an excuse for student behavior. However, using it as a lens helps us to understand how to support students better while still having high expectations. Support all students to feel safe, because lots of times those students who their behavior may indicate that they're having a hard time, that they've had some trauma, just simply don't feel safe in the classroom. So finding a way that makes them feel safer. For some kids, it's being closer to the door, things like that. Where there are other kids who have, doesn't really matter where they sit, they're just gonna talk with their peers anyway. Address student needs in holistic ways, again, looking at the whole child. Embrace teamwork and shared responsibility. So again, being on the same page throughout the building. Connect students with mental health resources, both in and out of school as needed, and anticipate and adapt to the ever-changing needs of students and the surrounding community. But what's important to remember is that resilience is, kids can be extremely resilient. Like my son, he's gone through a lot, and he's making it. Trauma-sensitive and trauma-informed environments allows educators the opportunity to collaborate in a way that supports a student's mental and physical health, so learning can occur. School communities that engage in paid professional development, practice, and support for all students, school employees create a culture that builds resilience for all students. And then these are some of the benefits for school staff. Staff who are trained in trauma report that they have higher knowledge of trauma and how to support students, and report significant decreases in emotional exhaustion and improved attitudes towards their school approaches.
So on the slide, I've got listed a couple different ways that North Branch area schools deals with that. And rather than go through point by point, I think the most important part of that is that in the last decade, schools have really advanced in how they handle it. I think that you see schools have a plan to handle it. And I don't know that that's maybe always been the case. And so while that outlines what we do as a school district, the most important takeaway is that almost every school in the state of Michigan has a planned approach on how to deal with it. And it's systematic. It's not just, you know, behavior by behavior. So I'm going to talk a little bit about the year so far. I love updating you guys on the year. We were here with you guys for the State Board of Education meeting. I got an opportunity to meet our cohort of regional teachers. It wasn't planned, but our previous presenters presented to the Michigan Teacher Leadership Advisory Council in September. So I didn't know they were going to be here today, so it was great to see them. They did a phenomenal job, and we dove a lot deeper into the presentation that you guys got to be part of. And so with that, as they said, it was just a really impactful experience. And one of the great things about this experience is, like following that experience, we Zoomed in my classroom and I had them talk with my class a little bit about some of the things that they talked with me about. And so it was great to be able to have that presentation, be able to share that with my students. And I know, Deidre, you had said that you used some of the material as well.
Yeah, so I have actually taught 4 of the lessons that were in the lesson plans already. So I was so excited to see them, to be able to tell them that. So with 3rd graders, and the lessons were great, super engaging. I learned a lot, they learned a lot. We did a lot of comparison in terms of like the kinship models and things like that. So it was really impactful, really great. I recommend it to everyone to check it out.
You guys had the opportunity to meet Tom Schultz from Charlevoix, I think maybe 2 months back. Very dynamic teacher. I got to watch him teach a lesson, stole some of those lessons, took them back to my home school for my science teacher to teach. And then I also got to see Susan up in Sault Ste. Marie at the Bowedding Anishinaabe School. She set up some really amazing experiences there for me. In the lower right, you see a picture from the night before. I was able to go up early and meet with some members of the local tribe and join them for drum circle practice. And so it was more than just practice. Between each song, we talked about their culture, what it meant to them, and a lot of things that you heard that earlier presentation. And so it was just a really welcoming environment, and I was honored to be invited into that drum circle and experience that and hear directly from people about their history. You know, I think Senator Bullock hit the nail on the head that when you hear people talk about their own culture, their own history through their lens, rather than told through a history book or somebody else's story, I think that's really important. And I think that applies to all cultures. And I think we need to approach education in those ways, especially when you look at smaller districts like Deidre and I are from, where there's not a lot of diversity, where they see most of history through one lens. And so, so I think it's really important that we continue that work. I had an opportunity to present along Deidre one as well, along with a couple other regional teachers at Central Michigan for their teacher prep conference. It's all students, or excuse me, all college students that are student teaching. Fantastic experience. The good news is there's a little bit of an uptick of the number of students that are going into teaching, but you know, just in speaking to Central Michigan and other universities I've been to, still not feeling like we're meeting the need of the number of vacancies we have. And so it's great to see young people gravitating back towards teaching. I think the best thing that we can do as educators is provide an exciting atmosphere for kids to learn in. You know, when kids are in our classrooms and they have a great experience, that's what's going to lead them to want to go into education. And so that's why a lot of the work and policies you guys make are so important, so that we can lead future teachers towards our profession as well. Do you guys have any questions or any comments for Deidre?
Thank you so much. This is a great presentation, and I appreciate both of you. I just want to make sure I understand. So it sounds to me that the trauma-informed model is something that you're looking, or it's the best practice would be if the entire school is sort of thinking about it. And the benefit, of course, would be to individual students that have had, you know, multiple of these adverse childhood influences or events. You know, absent mandates, and, you know, being a local control state, I think most school districts are really hesitant to embrace mandates. What might that look like in terms of are school districts, because you said a lot of them are already using, are they voluntarily sort of embracing it because it's good practice? Is it coming through teacher preparation where teachers now are more versed in teaching through that lens? You know, how does it get adopted practically?
I think a lot
for
of it
all
was birthed
students?
out of the students that we were working with coming out of COVID. To be honest with you, we saw a lot of, I can speak mostly to my own district's experience, just a different buy-in from students, a different attitude towards school. And, you know, I think we've really, as a society, we've gained momentum in mental health awareness and talking about those things. And so rather than pushing them aside and just saying that kid doesn't know how to behave, we're looking at more of what that behavior speaks to us and what it tells us. So for us, I know local controls work very well because we've been very proactive with it. It's given us the flexibility between buildings to do things that are a little different. In the slide, we outlined what each building does, but each building does things a little bit differently to meet the needs of the grade bands that we work with. So I think that's important to give local districts flexibility as well.
Thank you.
Ms. Snyder?
Regional Teacher of the Year presentation ever. Really, it was very good. Thank you for sharing. I just wanted to say that. And then you had a slide at the beginning that referred to APA's definition of trauma. I was kind of surprised just to take note, you know, collectively as a group. I don't think it mentions sexual abuse.
I think they may be calling that under physical.
Okay.
Yeah,
Usually
they are
they
different
differentiate it.
categories. So I was surprised also. It is under the ACEs. But the ACEs questionnaire wasn't developed by the APA. My guess is that they're calling it part of physical.
Hope it's not confused with more, because it's like definitely more in the forefront, and probably maybe they should revisit that and differentiate it. But I really appreciate your sharing.
Thanks.
Senator Bullock?
Thank you. Great presentation. I had a couple like wild thoughts, but my first was like when we're working with kids with trauma and other behavioral issues, like what are we doing to educate the other students in the classroom, or like how are we dealing with them? Because they also got to deal with that on a daily themselves. So is there like are we working a plan to do that, or is there some?
Educate them around how we support other students, or
However, everything's going to be individualized. So
yeah, in my experience, what's worked really well is just having a really solid social emotional learning background with the students. So they don't need to know anything about why another student's having a hard time, but they do know tools that kids can use if they're having a difficult day, if they're feeling sad, if they're feeling a little anxious, things like that. And then I've seen a lot of students then will like co-regulate with a student and be like, oh, it looks like you're a little anxious. Would this squishy help you a little bit? Or maybe you want to take a walk and get a drink of water. So I think in my experience in my own classroom, my kids really seem to learn each other and their cues. So we don't actually call out that this person has a background that is difficult.
all of that, you know.
Yeah,
so
yeah.
Like in my
Just,
world,
yeah.
and even in juvenile, it's okay to not be okay.
100%.
So if everybody understands it's okay. They don't
Yeah.
need to know the issue or what's
Yes,
happening
100%.
at home, what's happening at school. So if we normalize it's okay to not be okay,
Yep.
then we have a better human understanding,
Yes.
even younger, about our peers, right?
Yes.
And so
Yep.
I just wanted to know like that. And then you had said something that triggered a thought in me, because my kids at one point went to different schools that teachers, they followed the teacher or the teacher followed the kids. So if it takes 8 months to develop a healthy relationship with an adult or the teacher, is there a consideration, like even in what would be considered normalcy, to have teachers follow the kids for at least 2 years, 3 years, because some places do 4, 8 years. Like I've seen it, but my kids at one point had 2-year teacher structures.
So I'm personally a really big fan of the idea of looping. I currently am teaching third grade mostly because third graders in our district transitioned to a different building, and I had this cohort, not all of the kids that are in my class right now, in first grade and saw a lot of social emotional need. And so I asked to transition up to support them in the next building because I had those relationships. Those are definitely things that, like, school to school, district to district. That's my personal priority as an educator is relationship building. So that is something that I think is a great idea. I know for my son, and he was in special education placement from third grade until 10th. And within that structure, he did have educators that stayed with him for 3 to 4 years, but also much smaller class sizes, things like that. So,
I've seen scenarios, especially in alternative scenarios, where person develops the relationship, then now youth is over here, but they always want to go see you. They always want to go see you, and so that disrupts your time with your other students, et cetera. You know what I mean? So can't always just let them come sit in my class or
yeah,
while I'm doing.
I think it takes two. I mean, when I transition my students, this class right now from first grade to second grade, it takes some really intentional work in helping them build that relationship with another adult, and so that's something too. When everyone's kind of on the same page, that's supportive.
And then the last piece is integrating the families to understand those things.
Absolutely.
Thank you. Great statement.
Well, I really appreciate the high-quality presentation. I think it's very important. It's related to the top 10 goal 3, trauma-informed instruction, the work you're doing. I love the school visits as we move on social emotional learning. I come from a district with a lot of immigrant refugee students. It is much needed. Give a shout out to a couple people back there, Dr. Swayden and Micah Staley, who did a great job, but across Michigan. So thank you for doing that. And I am also a big proponent of looping. I did it as a middle school principal, and I've seen the benefits for students and as an elementary. So thank you for the work you do, and congratulations on your awards. Great job. Okay, the time is now, let's see, 12:31. We're gonna, the committee for the whole will adjourn for lunch. I'm gonna give us a 45-minute, if that's okay, to make up some time. I would also ask, and it's voluntary, but we would like to, if possible, to get a picture outside there. Mr. Wheaton's going to be ready for that with the board members as my first meeting, so, and then we can enjoy our lunch. Thank you.